So, chapter three, we're going to start talking about how drugs have their effect, how they get into the body, how they move through the body, hopefully to the place that we want them and less to the place we don't want them, and how they are eliminated from the body. And then that is called pharmacokinetics. And we're also going to talk about pharmacodynamics later, and that is actually how drugs work in the body, how they exert their effect. So I want you to just take a minute and think about these two patients and think about how the dosage of a drug would differ between these two patients. And when we're talking about a dosage, we're talking about the amount that we're giving, usually in milligrams, per weight of the animal. So the dosage could be the same in these two animals, or it could be different. So on our left, we have our little puppy, maybe just a few weeks old, still has its present package on it, a ribbon. And then we have our sweet geriatric patient on the right. And when you think about the difference between these two animals and how drugs might exert their effect on these two animals, the thing that you want to think about is what are the organs that um, remove the drug or metabolize it so it can have its effect. I'm going to have just pause just a second for you to think about which organs those might be. Okay, not going to take too long, but I hope you were thinking of the liver and the kidneys. And I know you cover the kidneys a little bit later in anatomy, but both of these organs, usually the liver is responsible for metabolism, and it might also be responsible for elimination, but usually the kidneys are the organ that handles that, although it can be either or both. So let's look at our patients again. We have a little puppy, just a few weeks old, and we have an older animal. And let's think about those organs in these animals. And the puppy their organs may not be up to snuff quite yet. It usually takes a little bit before they are fully, have all the enzymes they need in the liver, especially in puppies, and um, and the kidneys may not be quite up to speed yet either. And then we've got our geriatric animal, and this dog might have some organ failure as they get older or less capacity to get drugs through them. So this is why we're usually doing blood work throughout an animal's life. And especially as they hit the age range, it's very breed dependent, obviously, but around 6 or 7 years of age, this is when we start to want to look at otherwise healthy animals and try to catch any liver or kidney changes early in the game. So when you look at these two animals, let's just say we're treating a bladder infection with an antibiotic. Um, we would maybe actually think of a similar dosage. Quite often in the formulary, there is a dosage range, a low end and a high end, and we might actually go toward the low end for both the puppy and for the geriatric patient, simply because their organs of metabolism and elimination may actually be more similar than you might think on first glance. All right, let's think about how we deliver a drug. So, and how that might affect the patient receiving the drug, and especially how fast it may act. So, if you look at our patient on the left, this dog is getting an IV infusion. I hope as a technician you're not actually holding the bag literally there. I hope you'd have a stand for it because you need somebody else to help hold that dog, although that might be a very obedient dog. But it has an IV catheter in it, and it is getting the drugs directly into the bloodstream. Once it's in the bloodstream, it's going to get to places in the body where we want it to take effect. So that's going to be pretty quick as far as how quick that drug is going to act. When you look at our patient on the right, we're giving a capsule. First, we have to get it into the patient. Sometimes that's easy and sometimes not. And then there's a variety of steps that have to happen before that gets into the bloodstream. So that's going to take a fair amount longer. And maybe all of it isn't going to make it into the bloodstream. It's got to get into the gastrointestinal tract, become dissolved, be absorbed, get into the bloodstream. Um, so there's a lot more that goes on in our patient on the right before that animal is going to be feeling the effect of the drug. So these are just some of the factors that we think about when we are going to administer drugs. And so that's what we're going to be looking at are factors that we consider, the routes of drug administration, and then the ways that drugs move through the body. This is called pharmacokinetics, as I said, how they move into, through, and out of the body. So there is a therapeutic range. The therapeutic range is what is considered the ideal or the accepted range of a drug concentration in the body that has the desired effect that we want. If we have too much drug, that is going to result potentially in a toxic concentration with side effects at a minimum, or much worse for too high of concentrations, could lead to toxic concentrations that do the animal harm. Insufficient drug is too low of a concentration, also called subtherapeutic concentrations, because we're not in the therapeutic area. So if you remember rule number 3 in your book from the first chapter, rule number 3 is all doses are guesses. And so, although the drugs have been studied before they go on the market and there is an ideal range of what we want to give animals, we have to remember that our patients are individuals and sometimes their therapeutic range may differ slightly from the published or ideal therapeutic range. So that's the goal. We want to keep that drug for as long as we need to treat the animal. We want to keep the drug in the therapeutic range where it's going to have the best action, cause the least harm, and keep it there for the time that we need to get it in there. So the principle of doing that is um, what your book refers to in this bucket analogy. And the idea is that the drug will enter the body at the same rate that it leaves the body. And so it reaches what's called a steady state. So, this bucket analogy, or bucket on the left, we are giving 3 drops. So this is maybe administering 3 amounts, let's just say, of a drug into this bucket, which is the animal's body. But only 2 drops are leaving in the same time frame that 3 goes in. If that's occurring, we're going to have a buildup of the drug concentration, probably beyond that maximum effective concentration, into the toxic range. So over here in the bucket C area, we have only 2 drops going in and 3 drops coming out. This concentration in the animal's body is represented by the bucket. It's going to become lower and it's probably going to get into the subtherapeutic range before we would want that to happen. The middle bucket is exactly what we want. 3 drops in, 3 drops out. That's where we've reached steady state. The concentration is remaining pretty stable in the animal, and it's allowing the animal to be treated by the medication. This is another way to look at it. So if you think about each of these times down here, and I'm sorry, I'm cutting off this a little bit. At the bottom it says time, multiples of elimination, half-life, and it is each time we're administering the drug. So when we administer it the first time, it goes up to a high concentration, its peak concentration, and then it starts to be eliminated by the body. We've added another dose at this point, and so the amount that's already in the animal and the amount that we've added to it, we reach a higher concentration in the animal's bloodstream. It too begins to be eliminated by the time we give the third dose, I should say, And now it's going to reach an even higher state. Eventually, and it's about um, 4 or 5 times after we've given a dose of the drug, we're going to reach the steady state concentration. This line, this curve here, is just showing the sort of average concentration that would be shown in the animal, and it begins to level off at a particular steady state concentration. So that's what's actually going on as we administer dose after dose to an animal. So we talked before about organs of drug excretion, liver and kidneys. If they become damaged or compromised, that's going to slow the excretion. And so we need to consider that in our older animals and our younger animals typically, or animals that have just suffered um, damage at any age. If we give fluids, that's called diuresis, we're going to increase drug elimination. So it's going to make the drug elimination go faster if we give it with IV fluids. And if an animal is dehydrated, that's going to decrease the amount that's going to be eliminated. So something that we think about when we administer drugs is the dosage regimen, and as well as the routes of administration, how we're actually giving it. For some drugs, it's appropriate to give what's called a loading dose. The loading dose is usually simply give 2 capsules in the first dose, and then 1 capsule twice a day thereafter. That two given in the first dose is to load the animal up, to get it up to that steady state concentration faster. The maintenance dose is the second part of what I said, giving 1 capsule twice a day. That's simply the amount that we need to keep that drug in the steady state. And then total daily dose. Some drugs in the formulary, they will allow you to give a drug 3 times a day or 4 times a day. It's a different amount each time, but it adds up to the same total daily dose. It's just either spreading it out more or giving it more concentrated. As we showed in that diagram, each time you give the dose, it's if you give more with each time, it's going to increase it more drastically than if you give smaller amounts more frequently. But the other side of that is that it's easier, obviously, for owners to give drugs less frequently over the day. But the total daily dose, the same idea is that we are giving the same amount in a particular day. We're just doing it at different frequency.